Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hello, welcome to this week's edition of The Holistic Nurse with Peggy Smith. Our guest today is Dr. Siepser, a local surgeon and practitioner here in the Philadelphia area uh, and associated with Wills Eye Hospital, which is internationally known around the world. Welcome, Doctor.
Pleasure to be here, Peggy. Thanks for inviting me. I look forward to uh, giving some new information to your audience and helping them out holistically.
So we got a little window of your practice and the holistic focus that you guys have with your associate a couple weeks ago with Michelle Prendrack. And, what would you like to, can you explain exactly how important the eye is and what you can do for the eye?
Oh, that's an excellent question. Peggy, people use their eyes. It's the most important sense to most people. If you ask them which thing would you least like to get rid of, and that's always vision. And your eyes are the seat of the soul. And so vision and how it interplays in our lives is extremely important. And we, in this practice, try to address all the concerns of patients. And you had Dr. Pendrak, who specializes this little eye model here, and the dryness on the front of your eye, which on the very front of your eye, if you have dryness, anything I do would be not important because that'll be blocking vision. The things I do is actually corneal disease, glaucoma surgery, cataract surgery. I work on everything here in the front of the eye, from the middle forward is my area of specialty. And in this practice, I'm the surgeon. So patients are seen by Dr. Passion and Dr. Pendrak, and they are evaluated for their visual function. Routinely, it's glasses or contacts. I'm a LASIK surgeon, so if patients say, gee, I'm really tired of my contacts, they're burning, they're bothering me, this doesn't give me the vision I want, then laser vision correction, LASIK, is what I do a lot of. I think now I've done almost 25,000 eyes, and that's a procedure we do in the very front of the eye. As you know, most people wear glasses, and that's helping focusing the light on the retina, the very back of the eye. And everybody's eyes are different shape, different length, different power. So glasses help people see better. When their eyes too long, that's nearsightedness, and that's the most common problem and growing exponentially. We have a problem with myopia or nearsightedness in the Western world. LASIK is a procedure that sculpts the correction of your glasses onto the very front of your eye better than glasses, because glasses are just like a sphere, they're a lens, and they can only focus the light at one point. But our eyes, every eye is different. You might think that the cornea, and that's my area of interest, this very front of your eye would be the same in everybody. And that clear cornea actually is different in everyone. I always say, if you look at a box of mushrooms, and they're portobello mushrooms, you can see they're portobellos, and they're not shiitake, right? Different shape, different. But if you pick up a mushroom and you look at it carefully, you see every mushroom is different. The front of it maybe is a little flatter, maybe it's steeper at the sides, or maybe a little curved or a little irregular. Same thing with any biological system. The front of our eye, in everyone's eye, is different. Our laser, the Vizx S2 IR wave scan laser, actually takes an impression of the front of your eye, figures out where the high spots, the low spots are, and then places an ideal correction right on your cornea. That's why almost 50% of the patients see better than 20/20, and 98% of the patients see 20/20 or better with the procedure called LASIK. Now, the other procedure I do quite frequently is cataract operations. And we've learned over the years, a cataract operation is removing the lens inside the eye. And those lenses, of course, every eye is a little different. They're longer or shorter, and the power of that lens has to be adjusted. But like all human structures, everybody's lens is a little different. And in reality, it's matched to the front of the eye so that if there's a problem here in the front, it's not quite curved, just like your teeth match. And you can always feel a high spot if there's something a little off. The cornea of the eye and the lens of the eye sort of grow and interdigitate so that the aberration is moved to its best. However, if you take a fairly normal eye and remove their cataract, and then you put in a perfect implant, that cornea isn't going to match. So there's several ways of doing cataract surgery. We actually can do cataract surgery with a laser. We can use blades, and we can correct astigmatism while operating. All that is often not covered by insurance. Interestingly, insurance, they say, we'll get you the best stuff. And of course, they turn to the doctor and they say, how cheap can you do it? It's really a very unique system. I was on the radio this morning on another podcast with Invest Philadelphia, and we were talking about what a unusual system we have in the United States, in that I have a patient in front of me, and I want to do the very best for them. But the company who is paying for their care, their profit depends on diminishing the care and cost for that particular patient any way they can. That's where deny comes in. Anytime they can save money on the patient's care, that's profit for the company and the stockholder. Broken system, we have to agree. Replacement, we'll have to work on. It's not working anymore. And the other weirdest thing is pre-certification and pre-approval. I mean, in cataract surgery, people see the result. How can you operate on somebody and not make them better? Because if they're not better, they go, I didn't need the operation, I get stuck. And so that combination of things has led to a definite basic change in the way ophthalmic surgeons deliver care. Medicare and the insurance company say, well, we'll pay for the knife, but we won't pay for the laser. Really? It's true. They will not pay for the use of the laser, and the laser can correct your astigmatism at the same time we do your cataract. Because the laser costs the surgeon and the center who owns it, $500, $1,000. It's very variable on what the cost of just using the laser might be, because there's interfaces and very complex devices that are used on each patient and then disposed of, and then there's what we call a click fee. You have to pay every time you use the laser. And that's okay. We live in the only country in the world where they can sell a device to you and you have to pay a licensing fee every time you use it. That's true in LASIK and true now in femtosecond laser surgery for cataracts. So we spent some time learning about the cornea and the human lens. When this human lens gets cloudy, and you might be able to see that cloudiness in that lens there, that's a cataract. But really, even a clear lens like this one, behind here, may not focus perfectly, even though it's still clear. It's not a perfect lens anymore. And that's why patients often come in to see us who've had LASIK surgery maybe 20 or 30 years ago here on the front, and they come in now 50 or 60 years old and they say, Doc, my LASIK is worn out. Well, that's not true. That's the front of the eye. It's usually the lens inside their eye is yellowing, distorting the light. And you first notice it driving at night, sometimes glare and halo. Those new bluish sort of headlights really accentuate glare and halo. So patients who come in to see us, we need to help them understand that it's not their cornea, it's the lens inside their eye. And we have a very interesting device called the ocular scatter index. And that device measures the amount of scatter. You can imagine if you have a flashlight and it's a clear night, you do not see the beam. If it's foggy, the light shines back at you and there's glare. Well, if the lens in your eye, or sometimes even the vitreous, the gel behind that, is cloudy, then the ocular scatter index, this number we know, goes up because there's more scatter. Now, the insurance companies will not accept that as a number helping us to say, gee, this patient needs cataract surgery. And they say, well, it's unnecessary because they don't have enough handicap. And I go like, you mean your artificial criteria is limiting the care of this patient in front of me because you say this particular test, like in our state, the brightness acuity test, we shine a bright light at you and we see how well you can see the chart. Sort of very artificial measurement, whereas the ocular scatter index gives a very, very clear and cogent idea of what a patient's true visual function might be. So ophthalmologists are now faced with, okay, we'll give you the Medicare thing, a $35 implant, um, surgery with knives, and it works really well. And there's no problem with that operation. I used to do 30 of them a week. Um, but I tired of that. And I said, we have LASIK. So patients come to me and they pay us to get rid of their glasses. And it's a great economic model because glasses and contacts usually run about $1,000 a year. And laser vision correction is a one-time thing. So patients who come in and get LASIK, and those prices are variable, but they're in the thousands. Within 5 years, they've made that money back, and for many, many years, they will not need glasses or contacts. So economically, it's a good decision. Health-wise, it's a good decision because very few people know contact lenses themselves are extremely dangerous. They're 10 times more dangerous than laser vision correction or LASIK because we see a patient, the contacts on their eye, maybe they sleep in it, or it's got some dirt, or they didn't clean it well enough, then a small infection can occur on the surface, on this cornea in the front of your eye. That occurs, that can lead to a lifetime loss of vision. And we've seen this on a fairly regular basis. LASIK doesn't have that level of complications that even contact lenses have. Now, not to get into the politics of why LASIK is not done, but years ago we used to do well over 2 million LASIK a year. We're now doing about maybe 400,000 in the whole United States. And you don't see advertisements on TV about LASIK. You see contact lenses. Now, how could that be? Well, it's pretty simple. Vizx was a company, that's where I bought my laser, and they had the expertise, and we had that laser for a decade. And recently, the company that makes contact lenses, Johnson & Johnson, bought Vizx, the company that supplies the laser for us and the interfaces and everything we need to do laser. Now, you don't see an advertisement on TV for LASIK, you see contact lenses. Why would that be? Well, when Johnson & Johnson went to buy the Vizx company, the FTC got involved. You say, wait a minute, you can't buy a machine that corrects vision because you're selling another product that corrects vision called a contact lens, and that's a conflict of interest. That's a monopoly. Well, they said, no, it's different. The laser's one thing and the contact's another, and we certainly should be able to. Of course, the attorneys for Johnson & Johnson won, and this is history because they have a model like any like razor blades and things subscription model where every year or every month you have to pay some money to get contacts. Like what's the better model? 10,000 every decade for contact lenses and solutions, or one procedure that lasts 20 or 30 years without difficulty? Well, obviously they bought the laser and they do not advertise or say anything about it. They push contact lenses. Oh, so next, a company called Bausch and Lomb saw what Johnson and Johnson did. They bought a company called Technolas, and they now have their laser and they sell contact lenses. Got another company, bought a company called Summit, the only other company providing laser vision correction lasers here in the United States. And of course, Alcon sells contact lenses. So you're not going to see much on laser vision correction or LASIK in the media unless it's something bad. And you don't see much about contact lenses and how seriously injurious they are either. So this has really distorted our business and the marketplace for laser vision correction. Any questions, Peggy?
No, a couple things came to mind though. One of the frequent questions I get from patients that had cataract surgery years ago is, I guess, my stuff is outdated. Can the doctor fix? Now I'm almost blind. Can the doctor fix it?
Oh, that's a great question. So, I was one of the first surgeons in the Philadelphia area who was fellowship trained to do implants. Intraocular lenses were not used 50 years ago, and they were only invented 75 years ago by Sir Harold Ridley, who I personally met in England. And contact lenses have evolved somewhat over the last maybe 50 years, but not truly very much. And usually, if patients' vision is deteriorated or they're having problems and they no longer can see well, most commonly in the older women, more than anyone, it's dryness on the front of the eye. And that dryness starts blocking your vision. So, treating that, and that's what Dr. Pendrak does, is also very important. But the lens itself sometimes can opacify the implant that's put in there, and we can go ahead and take the old implant and put in a new one if necessary. That's pretty rare, but I do more of those than most here in the Philadelphia area. Just yesterday, I operated on a gentleman. He was riding his lawnmower. He got hit with a rock. The lawnmower bounced a rock off a wall, ricocheted into his eye, and knocked his intraocular lens implant out of place. And so there are procedures now, and I did one yesterday, the McDowell procedure, where I use sort of a hammock suture. And you think of a hammock with two strings at the end holding that nice, comfortable bed in place to sling the implant back into position so the patient can see again. And I've done thousands of those. Now, one of the most interesting areas is I've always been interested in the iris, the pupil and the brown part or blue part of your eye. I actually developed a procedure called the Siepser sliding knot. In the old days, when we did cataract surgery, they cut out part of the iris and then reached down to get this implant, the intraocular, the human lens, the phakic lens, or human lens, out of the eye in one whole piece. And that was called intracapsular cataract surgery. And that, in my senior partner at Tate there in Norristown, I had hundreds of patients who had what we call keyhole iridotomies and iridectomies. They were missing part of their iris. So I started sewing those together. And I had heard of something called a mechanical suture, which worked, but I had to open up the whole eye. So I developed the Siepser sliding knot, where I actually suture inside the eye, tying the knots from outside using a technique I use in fly fishing, believe it or not. And that's changed the way we manage pupillary defects. I just had a patient who came from Pottsville who had been, as a kid, had been hit in the eye and his cornea had been damaged. His iris had torn, and we can show you pictures of that if we have a chance. And he had developed a traumatic cataract, and we were able to get everything organized and get his pupil back to where it belongs. And now he can see. He can't believe it because these things are sort of unknown. I'm out. I talk to groups. I talk to ophthalmologists. I've trained 300 ophthalmologists to do that procedure, but not everyone can do it. In fact, patients still hear from their doctors, no, don't bother. If you've had it all your life, there's no sense doing anything. And, Peggy, I was a pediatrician before I became an ophthalmologist. And we were trained that if you could do something for a kid, even if he was severely handicapped, if you could make his life better in some way, you could go ahead and do it. Because a lot of times with older adults, surgeons develop this attitude, well, you're okay. You're old. We're not going to do anything. And from my training as a pediatrician, I was given the option, well, I can make your life better this way, or we can do LASIK. Even the oldest patient I've ever done LASIK on is a 92-year-old.
He had prior cataract.
He had cataract surgery. He really wasn't seeing well because of a high degree of astigmatism and distortion. And of course, doing LASIK allowed him to see great again because his problem was in the cornea, and that's the area the LASIK can correct.
So I know working in home care, I see a couple different situations. People that either are using contacts or people that have dry eye issues even. There's not a lot of education, it seems, with they'll be like touching their dog and then doing their eye drops. And yeah, I love my dogs, but I'm gonna wash my hands before I do eye drops.
Well, because you're a nurse.
But I've even seen nurses that working kind of a long shift. They want to change their contacts or take them out, and they're in a high infection environment. Even they just and I've never seen I'm not going to name a name brand, but a tractor lawnmower commercial that tells people to wear goggles, and I've never seen people wear goggles when they cut the grass. That might be.
They should be. Yeah,
they should be.
And our gentleman who had this happen, he's 88 years old, and he's riding it. And I said, Mr. X, maybe it's time we didn't ride that lawnmower anymore. He said, no, I'm not giving it up. And I said, all right, well, safety glasses. And yes, they're great. You can get them when you go to your John Deere store or wherever you go to buy your equipment, steel, whatever. There's always a stack. You can buy a dozen of them at a time. And they're very inexpensive and very effective. They're made of polycarbonate. They're clear the minute they get scratched, throw them out, put on another pair. And on our farm, where we have tractors and weed eaters and chainsaws, and we have a lot of people working there to keep the place together, everybody's got to wear safety glasses.
We're going to take a brief moment here and take a break, and we'll be right back.
Excellent. Thank you.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Okay, great.
Hi, welcome back. I'm Dr. Stephen Siepser, who's an accomplished and well-experienced and innovative eye surgery, and he's going to continue the conversation.
Well, thank you. Uh, I wanted to move from the front of the eye, the LASIK, the cataract, corneal transplants, all the things we do up front, maybe into the middle of the eye. We had a patient yesterday who came in and she said, I was seeing a floater. So my doctor sent me for an MRI and all these tests. And floaters are very interesting. If you stare up at a blue sky, almost everyone will see a little image of some swirls, things coming around. But as we age, floaters can become much more bothersome. And floaters are the gel inside our eye here that sort of pulls from the back. Let's see if you can see that. And floats around in front of that. And that floater can interfere with your vision. Sometimes it can be quite dense. And when we remove cataracts, and sometimes without, we can actually remove floaters. We call it floaterectomy. We do that when your vision is quite disturbed. In other words, I always ask patients, I say on a scale of 10, 1 being you just notice this once in a while, and 10, you can't go on another day, what number would you give your floaters? And if it's anywhere higher than 7 or 8, then we propose a surgery design for that patient. Now, dealing with these complex problems has always been, it's an art form because every complex problem is different. I can have a patient who has had LASIK, who's had cataract surgery, and has floaters, and we can just remove the floaters. But first, we have to start from the very front. Is there a disturbance from dryness or an irregularity on the surface? And I correct that. Is the human lens not functioning correctly and distorting the light? Or is the gel in the eye gotten so dense that it's blocking vision? Along with those things, we routinely screen patients for glaucoma. Now, what's glaucoma? Glaucoma is when the pressure in your eye rises to a level where, if you can see in this model, there are blood vessels. This is the optic nerve that comes from actually the eye is an extension of the brain, and it's supplied by these arteries and veins that supply the nourishment to our optic nerve and the retina of the eye. If the eye pressure rises, then the circulation, the blood can't get in there because it's coming in. It's like when you're pumping and you've gotten your tire really firm, those last pumps are really hard. And so if the eye's too firm, the blood can't get into the eye, the nerve is damaged. And interestingly, with glaucoma, the vision is lost first from the sides. And that's why glaucoma is called the thief of the night, because patients don't really see their loss until it's gotten very severe, and that's too late. That's why everybody over the age of 40 should at least have an ophthalmic examination, have their pressures determined. Now, really between the ages of 21 and 40, maybe not as necessary. Every 5 years is fine, especially if you don't wear glasses. But if you have a family history of anyone with blindness, decrease in vision, or the word glaucoma or eye drops has been used, then you're at much higher risk of glaucoma and you need to see an ophthalmologist. Now, in this practice, I do about now 6 different procedures for glaucoma. We don't use drops in this practice anymore. I think in England, the first line of therapy now for glaucoma is to use a laser. Now, if we look at our model here, take these out so we're not dropping everything everywhere. You may be able to see that little black dot there. And the fluid comes from inside the eye, goes through the pupil, and then out this little vein there. But there's a screen in front of it, sort of like the drain, the screen in the drain in your kitchen sink. And just like things can collect in your kitchen sink and the water can rise, in our eye, when that screen gets too much pigment on it or debris or just age changes or hereditary changes, then we have to do something. Best and fastest, easiest thing to do is called selective laser trabeculoplasty. What we do is shoot the laser into this angle here, and it sort of disrupts the membrane, it removes debris, it allows the fluid to start flowing again, and it works about 80% of the time. Patients no longer need drops. It's best actually to start before you use drops, and then it's most effective. And it lasts from 3 to 5 years, and we can do it up to 3 times. That really changed the way I practice glaucoma. We have the most amazing machines now. We can use something called the optical computed tomographer, which actually measures the number of nerves in your eye. So if we see that nerve count, the nerve fiber layer is decreasing, even before you have loss of vision on the side, we can show that you're losing nerves and that your pressures are too high. Most amazingly, the reason that glaucoma is also called the thief of the night because we believe the highest pressures occur between 4 to 6 to 8 in the morning. So you go into your ophthalmologist at 3 in the afternoon, he checks your pressure, oh, it's 18, it's fine. Because the normal pressures are between 11 and 21. If your pressures are going up to 26, 30, then you're going to lose nerve because then blood can't get into the eye against that pressure head. However, that usually occurs very early in the morning. And checking patients now, maybe at most every 3 months, it's like one measurement. We actually have a device called the eye care home care tonometer, and it's a device that you can rent and test your vision as many times as you like during a day, sort of like a pressure cuff for your blood pressure. You know, when you go to the doctor, there's something called white coat syndrome. I'm a flight surgeon, and our young pilots come in, and their blood pressure is always off the chart. So we don't do their blood pressure until the very end because you do in the beginning, it's crazy high. So people's blood pressure varies, and their eye pressure varies. And just like you can test now, you can get a home tester for your blood pressure. There's now a home tester for glaucoma. We encourage our patients to use it. They're very expensive to buy, but you can rent it. Then patients can report to us, oh, I was fine most of the day, but yesterday morning I checked at 8, my pressure was 26. So what we find with this selective laser trabeculoplasty is that the best thing it does, it removes the peaks of pressure. So you don't have those spikes anymore in the circadian rhythm. And so we're able to really stop glaucoma in its tracks. Now, glaucoma is a lifetime disease, and there are various very aggressive types of glaucoma, pigmentary glaucoma, which is an area I have a great interest, pseudoexfoliative glaucoma. These are hereditary glaucomas that really are very progressive. And one of the things we do actually is sequential. So we've done SLT, it worked for a few years. Now the pressure starts rising, the field or loss of side vision occurs. We can do something called a goniotomy, where we open that membrane with a tiny, tiny knife, and then that puts the fluid inside the eye directly to the veins. There's something called the infinity eye stent, which I like. It's these little snorkels I put sort of through the drain in like your sink, and we force in this little plug with a hole in the center of it that lets the fluid drain out of your sink. Same thing, we put three of these things, um, and if they're well placed and well done, about 50% of the time, they're quite exceptional in their effect. Actually, my favorite operation is something called eye-track viscocannulostomy, where I take a probe that's about 300 microns across, that's a fiber optic probe with this beautiful little red light, and I thread it into that vessel, which is around 300 to 400 microns thick, and I circle it around the eye, and then I inject this very gel-like substance that sort of opens up both sides, the trabecular meshwork, that screen, and also dilates the vein to let the fluid out of the eye. And that works, again, about 50% of the time.
When you talk about the nerve damage and everything, I'm thinking of diabetics now with their normal nerve damage, the peripheral neuropathy. Do they have a higher incidence of, is there a correlation there, or are they
It's
less likely
interesting.
to be successful?
Uh, Patients with diabetes don't seem to get glaucoma as frequently. It's got something to do with the eye pressure. If the pressures are high, somehow glaucoma protects them a little bit from diabetic retinopathy. But, I'm an anterior segment surgeon. And of course, we always look to see if people have unusual blood vessels in the macula, the fine vision center. We look back there, but that's the purview of a retinologist. If there's unusual blood vessels there, sometimes we can give injections, there's lasers, there's vitrectomies, there's a whole bunch of things we can do as long as the patients come in, they get checked. Because if you wait until it's too late, once there's damage, that's not really true in medicine. Holistic medicine is sort of like preventative medicine. And my approach is if you're holistically doing great, don't touch it. But you need to be checked on a regular basis. And if there's a problem, you need to address that specific problem because all the things in the world, if you have macular degeneration, there's very little that can be done for you other than injections and the care of a retinologist. Just like a cataract, if you have a cataract, no matter what you eat or do, at the point if you already have your cataract, you're going to need it removed. Now let's talk about how do you prevent cataracts? Well, it's pretty easy. Diet, exercise, and the standards. Low body weight, no smoking, no alcohol. Simple, right? We're not going to do any of that stuff, are we?
So, that's interesting because most people don't even think that what I know there's more eye vitamins being taken now.
They can help. That's really interesting. We went to the NIH. I was a guest there. It was an incredible place, and they had lecturers there who were. We used this something called ARIDS 2 and some vitamins for macular degeneration, and they are very effective. But one of the researchers there showed us that the Mediterranean diet, green leafy vegetables, olive oil, non-saturated fats, fish, those things are very protective of your eyes. And um, interestingly, in smokers, macular degeneration, the irreversible loss of vision, occurs 10 times more frequently, and cataracts occur 5 times more frequently in smokers. And it's the oxidative stress. Their body's constantly being challenged by inflammation and all sorts of carcinogens, and they're under stress all the time. So, would you advise a patient to smoke for their stress?
Not at all.
No. And that's what's happening, here in America. We're not the most democratic country in the world. You know that, right? We have something called lobbyists, and that's like legalized corruption.
Hmm.
And that's why you don't know how bad alcohol is. And the people who sell cigarettes were able to, and they still have. If you go to Canada or Europe, there's these terrible pictures on a pack of cigarettes. You never smoke them, right? But here in the United States, still looks like Marlboro packs, right?
Right.
So, those companies are very influential in our government. And your personal health, you need to see a holistic practitioner who will help you live in a healthy way and avoid many of the problems I deal with every day by just being
That
in
applies to
touch with your body and being careful what you put in your body.
So we're going to take one more brief break here, and I think probably have like closing messages for people.
Good.
Thank you.
Did you know that your beliefs create your entire reality, but it's the subconscious beliefs that do most of the creating? Belief shifter and life coach Shiraz can help you identify those limiting beliefs and eliminate them, often in a single session.
Like it was almost instant, like I had relief right away.
Creating better health, relationships, careers, and finances. Let Shiraz help you step out of safety and into awareness.
Definitely something's happening. It's like a flow inside. It feels good.
Whether in person or online, Shiraz provides personal coaching, belief shifting. Visit Shiraz at energeticmagic.com or call 416-529-7429. Energetic Magic. Find your greater happiness. Be well. Be aware. Be magical.
It's called the Zen Shunt.
Hi, welcome back. We've got about a few minutes left in our program, and doctor's going to explain a little bit more goodies for us.
Yeah, I just wanted to cover a couple things that let's see, there we go. Okay, I'm in there because I'm cut off at the head, but that's fine. One of the things I did want to talk about is in cataract surgery, in our practice, we use this flexible implant. So when we take your cataract out, we put back a lens that actually works like your lens where you're in your 30s, so you don't need readers. That's really fascinating. The other thing I did not mention, which I wanted to be sure to mention, is some people have been told they can't have LASIK. Their cornea is too thin, their eyes too nearsighted. But there's almost no one that we cannot do a procedure called the EVO, where we put actually a special contact lens, this little clear thing, we put it inside the eye. Amazing operation, and patients get incredible results and the best vision they've ever had in their lives. So we can do just about anything, it seems.
And there's no maintenance when you do that?
No, once it's in, that's it. They last. I've had them in now, some patients for over 20 years, and often highly nearsighted people develop cataracts much sooner than the normal population. So when we take out their cataract, we remove that extra lens, and then we put in our flexible lens, and then they see again like they were in their 30s.
Okay. I know, well, first of all, a little self-disclosure. I'm actually a patient of doctor, and in this past year, I went from wearing glasses as a preschooler until now, almost my seventh decade, and I can read without glasses, and that's pretty exciting. It's well worth the attention because your vision can slip away so quickly that it's insidious. You just don't
You don't
notice
know it.
until you can't see something. Um, and for seniors, it's important to preserve your right ability to drive as long as you can. It's part of our independent skills. And a lot of times, loss of vision, of course, is the first reason why you lose your ability to drive, no matter how healthy your body is.
That's a very interesting thing. I did want to mention, please, for my hearing aid people, cataract surgery, because it's shown that if you let cataracts go on too long, it affects your cognitive ability. It's got something to do with the sharpness of vision and the stimulation in your brain, just like the sharpness of hearing. All that helps you maintain cognitive ability.
It's shown there's a direct correlation to dementia if
Right.
people that don't get hearing aids, and hearing aids are a lot more affordable now than they used to be. So it's
And cataract surgery is usually covered by your insurance, unless you want to get the fancy stuff.
right. So, well, thank you very much. I really appreciate having you. Thank you for what you've done for my vision.
Yes, you're
So,
welcome, Peggy. It's been a pleasure.
and if anybody has any questions that you want to put on the YouTube page, we're glad to get answers for you. I hope this has been informative and helpful. And, just as Dr. Pendrick said a couple weeks ago, eye care and eye health is not a luxury. It really is as basic as getting your mammogram and your colonoscopy.
And brushing your teeth.
And brushing your teeth. Yes. So thanks a lot for coming today. It's been a pleasure.
Thank you.
And we'll see you guys next week. Thanks for joining us.
Excellent.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.